Autism Fitness founder Eric Chessen here, and I'm coming to you with another edition of Autism Fitness Tuesday Training. And in this edition of Autism Fitness Tuesday Training, I'm going to be talking about expectation management. Yes, managing expectations around a fitness or adapted physical education program or session for the autism and neurodivergent population. Now, of course, if we're talking about fitness and adapted PE, we got to be talking about utilizing the PAC profile to assess and address the 3 skills that really are meaningful and necessary to understand in order to have success. And those 3 areas of ability are physical, adaptive, and cognitive. So we have the physical, those are the exercises themselves and our athletes' ability, wherever it is, to perform each one of those exercises. Then we have the adaptive, their motivation level or their focus on each exercise or for the session itself as a whole. We'll get to that in a little bit. And then cognitive, we're looking at neurological and neuromuscular. The neurological related to communication and information processing, and the neuromuscular in the ability to follow an instruction, whether it is a physical guidance, verbal, or some type of mirror prompt. So in looking at everything through the lens of the PAC profile, physical, adaptive, and cognitive, the first thing that we have to do in expectation management is to have a basic expectation for our athletes. So the overarching or the umbrella expectation is that we are here in the gym or the clinic or the classroom or whatever the environment is, even at home for you parents and family members. We are in this place to do fitness. We are here to get exercises completed so that they have a training effect so that we can get stronger, more stable, and move better. That is the outcome that we're looking to do because this is a specified set of activities, right? So that's the general. And then we get into the specifics with that particular athlete in general, and then specifically to that session as well. So we can look at it from the macro level and then the micro level, still taking the physical, adaptive, and cognitive into account. Here's what I mean by that. So once we get a baseline assessment of our athletes' current physical, adaptive, and cognitive abilities as they relate to fitness and adapted PE programming, we can start setting expectations for performance around each exercise, around the instructions, around communication, and around focus. So first, it would make absolute sense, and it's critical, to have a little background information to understand how this athlete operates in this particular environment. So even before we start that fitness session, we want to know, how does that individual transition from one environment to another? For example, a lot of our autism athletes may have a lot of anxiety around or some challenges transitioning to the outside environment or from the hallway into the classroom or from outside into the clinic or from outside into the gym. And this can be a factor in setting expectations as well. So that's something that we want to consider and build into their programming. So let's start again from the physical perspective. So from the physical perspective, when we are setting expectations, once we have that baseline for each athlete doing their medicine ball push throw and their hurdle steps and their squats and their overhead press, we understand what their current level of ability is. And we want to hold that standard of, right now, we know that 80% of the time you can perform at this level with a sandbell overhead press. Great. So as long as we hold that expectation most of the time, and there are situations where we may not be able to do this, and we'll talk about that later. As long as we're able to hold that expectation most of the time, we're going to have a high quality outcome or result because we're going to be programming towards that athlete's current level of ability and gradually increasing the demand of that overhead press. So either more repetitions or a heavier weight, or even fading ourselves back from providing that physical or mirror prompt. So as the expectation grows bigger, we're also going to have more of a training effect and a better outcome. So the expectation is going to change in accordance with what the athlete's current physical ability is with each one of those exercises. Now, we get into adaptive functioning, and this is where things get really interesting, particularly when we're talking about the autism and neurodivergent population, because the adaptive or motivational functioning is often the biggest single challenge or obstacle to having the athlete perform enough sets and repetitions with enough quality movement that they are getting that training effect. The training effect is what we are after. Training effect means that there is significant volume and intensity of the exercise that the athlete is going to derive some type of benefit from it. So that adaptive functioning can be a point where we need to strategize as well. Earlier, I spoke about the athlete transitioning into the session. Sometimes we have an athlete who needs 5 or 6 or 7 minutes to self-regulate or to decompress in order to be focused and attending on the exercise. So that's something that we might want to build into our session. And there are a couple different strategies that we can use for different athletes. Great one is to use visual schedules or social narratives so that the athlete knows what's coming next in their session, and so that they have an opportunity to review it and be sure this is what's going on next, this is who I'm working with, this is what we're going to be doing. So that can be a great strategy for athletes that become anxious and really need to know what's going on in the near future. Another one is to have an early success in the session as soon as the athlete comes in. So even handing a medicine ball back and forth or grabbing a band and doing 1 or 2 repetitions of a band pull, even though that in and of itself is not going to create any type of training effect whatsoever, what we're doing is getting the athlete ready to achieve more challenging exercises later on. And we're starting them off with a success, which can be a big, big deal. And it can help to de-escalate some of that anxiety as well, if in fact that is a factor for that particular individual. Then we get to cognitive expectations. So cognitive expectations are normally around the level of prompting or cueing that an athlete will need with a particular exercise. So if we have an athlete who is able to do 10 medicine ball push throws in a row, our expectation is that they're going to do a set of 10 and then probably another set of 10, not that we're going to have to step in and do some type of guided physical prompt every 3rd or 4th repetition. Now, if that happens, we can always modify the exercise for that athlete. However, in that situation, we want to get back to what their starting point was, being able to do those 10 push throws without us modifying the exercise. So we do want to hold that expectation as much we can, as we would do with any other athlete, because ultimately we look at what we want our outcome to be. We want our outcome to be the athlete performs the exercises with enough quality repetitions, enough quality sets that there is that training effect. Now, coming back to adaptive functioning, sometimes we have an athlete who does get overwhelmed and they get dysregulated during the session. So we're not going to have enough time to get in every single exercise or even every single set of the exercises that we wanted to do. So when we talk about expectation management, both on the side of the coach and then when we're adding in parents and family members and other professionals, discussing what needs to get accomplished in order to move to that next step, in order to move to that next goal. All of this is actually a mathematical equation. So the mathematical equation of expectations in an autism or neurodivergent fitness or adapted PE session, as it is with neurotypical sessions as well, the equation is, are we able to complete enough sets and repetitions of X exercise, of let's say a squat or a standing band row or farmer's walk, at a certain level of challenge such that the body needs to get stronger, more stable, move better over time to have that skill generalize to activities of daily living. That's why we have this program for our life skill athletes. We want to develop all of these movement qualities that generalize to activities of daily living. That's why we're doing this. So the expectation around this is there needs to be a certain amount of sets and repetitions performed each session over time cumulatively in order for these skills to develop. So it's not going to happen in 1 or 2 or 3 sessions. This is something that is going to take time. Now, in the 20 plus years that I've been running fitness programs for the autism and neurodivergent population, I've found that the general time frame where we really start to see some of these skills develop to the point where they are generalizing is going to be around 3 to 4 months or so on average. Now, that takes into account a wide range of ages and ability levels and profiles. So again, that's a sweeping generalization, but with about 3 to 4 months of consistent fitness or adapted PE programming, wherever you're running your programs, we're going to start seeing a training effect. Now, that training effect is going to come sooner with athletes who are more motivated and more focused because, well, we're going to have more sets and repetitions completed. So if that athlete is consistently completing 4 or 5 sets of an exercise each session, well, yes, we're going to see a training effect occur sooner. So expectation management, it's really about functional and clear communication between all parties involved about what's going on, what the focus is, what the priorities are, because sometimes the priority is on creating a reinforcing environment, even if we're not getting to all the sets and exercises that we want to get to, but we need to focus on the athlete first. If we're going to look at fitness as a long-term development strategy that someone has over the course of their lifetime, we need their active participation in it. In order to have that, there needs to be a reinforcing quality somewhere in that program for that athlete. So this is something that even if we're starting out with minimal exercise accomplishment in a session, that's okay, as long as we have that time and consistency. And that's where we see these small steps become leaps and bounds because the athlete has enough practice, feels comfortable, confident, capable with the exercises, and we see that gradually they're starting to develop that strength, that motor planning, all of these great things, but it does take time. So expectation management is all about having these dialogues and understanding that we're starting right here with physical, adaptive, and cognitive capabilities. These are our next appropriate goals, and moving on and moving on. Occasionally there are setbacks as well. I have athletes, especially in their adolescence when they're going through puberty, where all of a sudden motor planning kind of falls apart and we have to restart. That's okay. We're on the right trajectory. We will get there. So keeping consistent, understanding that this is a long-term process, is going to be the most effective way to carry this on long-term. I hope this has been helpful for you. I'm Autism Fitness founder Eric Chessen. If this has been helpful for you, please like, please subscribe, and if you think it might be helpful for someone else, please share. And if you are ready to become an Autism Fitness certified pro, you can hit the link below, register, and anywhere in the world you can get started with becoming the best possible coach for your autism and neurodivergent life skill athlete.